Once you get set up for the TFL, again, we're looking to landmark the ASIS, so the frontal hip point, and the greater trochanter. Okay, if you need assistance with the greater trochanter, that's where you would use some rotation of the thigh in order to find it, but here on a manual it's quite prominent. So once you've got those 2 points, we're looking at a straight line between them, and so we get a nice purchase on the TFL at the front of the hip there. Coming for our first application, we're coming from a position quite superiorly located, so I'm quite close to his head, and that's going to give me a really good angle with which to take the tissue inferiorly for my sink and draw. And when we're doing it here on the TFL, we're really not looking to glide anywhere on this sink and draw, so we want a good grip of the tissue, and we want to introduce that tension and keep it there, as opposed to gliding. Again, we would also want to couple this application of myofascial stretch with our trigger point release work if the TFL is experiencing some troubles. Once we get a nice little creeping there of the tissues, we can release and repeat. I'm going to show you for the repetition, I'm going to show you a different axis. So we want to be down closer to the pelvis on this one, and I'm getting a grip of the TFL, and this time, as well as moving inferiorly, I'm also angling myself so that I can take the tissue posteriorly. So to do that, as I apply my sinking pressure, in order to get the draw at the angle that I'm looking for, my torso actually needs to come forwards, and then I can keep my arms straight and just use my body weight in this myofascial stretch. Similarly, we're not looking to glide in this one. We want a good purchase, and we want to sink in, introduce tension, and stay there. Once we feel that little bit of creep, we can release that